Now, in our first story in this bulletin, there's a crisis situation in the Ashanti region in the treatment of its COVID-19 cases. So far, the region has recorded 2,403 cases with 38 deaths. At a news conference, Ashanti Regional Director of Health, Dr. Tinkorang, said almost all treatment centers in Ashanti region are full. Meanwhile, a total of 97 healthcare workers have been infected with COVID-19 in their line of duty.
Almost all the treatment centers are now full. Kofanoche has 18 beds. The 18 beds are now full. Kumasi South have 20 beds. So as at now, we have a total of 38 beds. All the 38 beds are now full. So what we've decided to do is that we need to expand the number of the beds that we have for the treatment centers. So we've decided that we are going to expand Kumasi South from existing 20 beds to 41 beds. As at now, we've been given another ward. Work is rapidly ongoing to make sure that we expand it. We've also secured 7 beds at Central Hospital to support our treatment facilities. And we are also negotiating with one of our senior doctors who has decided to give us his hospital to be used as a treatment center. When that one is finally done, we hope that we can add about 100 beds to the treatment centers that we have to make sure that it will be up to about 38 beds. Because the numbers that we have here and the number of cases that we are getting, it said that we cannot contain it. The challenge we have here is the way cases are referred to our major treatment center, Kofanoche. Most of the cases are being kept in various hospitals, and when the situation gets worse, then they say, go to Kofanoche. And by the time you get to Kofanoche, less than 24 hours, then you are gone. I don't think that is good enough. We need to build the capacity of our peripheral facilities also to support the process. We'll have to build the capacity of the nurses there to identify the cases. The challenge we have with COVID deaths that we've analyzed here is that most of the deaths do not come with the classical signs and symptoms that we know. The cough, difficulty in breathing, and other things sometimes are absent. All that we get is malaria-like symptoms. So people assume that it's malaria. By the time we get to know that it's COVID, then a lot of health workers have been exposed. And because of that, most of them are now doing self-isolation. So there's a need also at the national level to review the signs and symptoms and then share it with the private facilities so that we do not focus only on certain signs and symptoms like cough, difficulty in breathing, and then it's COVID. Because in Ashanti region, we are seeing quite different picture. It's fever and general malaise. By the time you have difficulty in breathing, then you're almost gone. So it's another work that I think we will need to do here. The number of isolation centers will also have to be increased because we are having an increasing number of cases.
Also warned the Ashanti region could see a spike in cases and mortality if people continue to flout the directives to wear face masks and observe social distancing.
Going around the region and especially working in Kumasi, sometimes you feel so disheartened because people don't want to adhere to the protocols and then the guidelines. Now we don't see the Veronica buckets anywhere. The social distancing protocol, nobody is observing it. You tell people to wear face masks and they are insulting you. With this, we can't fight COVID-19. People get conditioned, we want to support them, they fight with us. How can we fight COVID-19 in this situation? The buck starts with you. The president has instructed that we enforce it. This morning, I went around looking whether people will adhere to what the president said. Some of them, they've disregarded what the president said. They are still walking around without their face mask. They are not observing the social distancing. So what do you want us to do? Ask people. That is not the way to go. Because right now, you know, we've lost a doctor, a hard-working doctor. And if it's to continue this way, what will happen? We are going to lose more. So my only appeal to people in Ashanti region is that let us obey instructions. Let us adhere by the laid down protocols and then the guidelines. Because with the ease of restrictions, it's likely that we may have cases going up. The facilities that we have in Ashanti region, as far as case management is concerned, is nothing to write home about. Accra may have UGMC, they may have Kolebu, they may have 37 military hospital, they may have police hospital. Ashanti, apart from Konfanochi Teaching Hospital, we don't have any facility that we can say can manage severe and critically ill. And that means that if we continue in this direction, we will see high mortalities. So what we need to do as a region is to make sure that we adhere by the public health principles. Other than that, we will have a lot of challenges. So the media, what you can do to help us is that let us try and then talk to people who don't want to obey any law in this country. I believe that it's time that we deal with them. We need to enforce the wearing of the face mask. And I believe we have the support of our regional minister. Even he started. And then some civil rights organizations and other things came in and said it's against the law. Nothing is against the law more than your life. We will not continue to live in this situation in Ashanti. And yesterday, talking to the regional minister, whether you like it or not, we will have to enforce it. And I believe that that is the only way we will have to go.